Well, as Omicron begins to surge, more kids across the country are also getting COVID and ending up in the hospital. While we're seeing sharp increases here, Caitlin Rust there says there are many factors keeping kids out of the ICU.
Over the past 10 days, as the virus spreads through the community, Children's Hospital is seeing a sharp increase in kids being admitted with COVID.
About a third of those patients have COVID-19 as a secondary diagnosis, meaning they're admitted for something else.
The number of pediatric hospitalizations is, of course, expected to go up in the next few weeks after the holidays with how transmissible Omicron is, but it's not expected to be as steep of a curve as the Delta surge.
The kids who are being admitted, they're not quite as sick as they were with some other surges of the epidemic thus far. So that's somewhat reassuring, although I'm not ready to say it doesn't affect children severely yet. We do have 14 patients in the hospital right now with COVID-19 illness. And most of them are in the acute care area, not the intensive care unit.
Dr. Leron with Children's Hospital says vaccination has helped ward away severe illness, but right now only a little over 6% of the state's 5 to 17-year-olds are fully vaccinated.
We've also seen an increase in interest from parents of kids aged 5 to 17 in getting that first dose of the vaccine over the last 10 days. So that's some good news. Unfortunately, it won't be soon enough to affect this current wave of patients, but it'll be better for these kids in the long term.
Over at NOLA Discount Pharmacy, pharmacist Con Tran vaccinates around 6 to 7 kids a day.
I think pretty much as soon as school let out, we've had every day a lot of people come in to get their shots. Doctors' offices, like pediatricians' offices, are quite busy. So whatever we can do to help, we try to put that out too. To help.
And he's right. Pediatricians all over the area are slammed, like Collins Pediatrics, which has extended its hours to accommodate.
Say over the last 2 weeks, right before Christmas, we went from having maybe one case every couple of weeks to several in a day.
Dr. Heather Porsche says it's much different than last winter because of all the other viruses going around.
Yes, a lot of COVID, but a lot of RSV, flu, common cold virus, rhinovirus, everything.
But the COVID she does see isn't what it once was.
A lot of times the viral illness includes fever, sore throat, cough and cold, but sometimes wheezing, but luckily so far, no, we have not seen a lot of hospitalizations and definitely not ICU admissions.
Caitlin Rust, Fox 8, Local First.
The doctor you heard from Collins Pediatrics says much like the hospital, they're also seeing those double diagnoses, and they're doing a lot of testing to figure out just what it is the patient has. She's also encouraging vaccination as the key tool to keep Omicron's symptoms mild.